very thin needles.
So you're
Okay,
saying it's a
so
procedure?
it is a procedure where it is a small procedure. It's not a very big procedure. We use very thin needles to get rid of the excessive fluid, whatever. It usually happens on the lumbar. So we have lumbar puncture. Let me write it down here for you guys. Lumbar puncture. And we have also acupuncture. This is the Chinese kind of, Chinese needles. Uh, if you have any information about that, acupuncture. It is still used in the U.S., so you have to memorize those guys. Let's get back to the sheet. So synthesis means puncture. Ology is the study of. Megaly means enlargement of. Guys, please mute yourself. And megaly is enlargement of, like cardiomegaly. Cardiomegaly means enlargement of the heart. Cardio is a root and it means the heart, and megaly is a suffix which means enlargement of. So cardiomegaly, enlargement of the heart. Ologist is the specialist. Whoever is specialized in anything, we just add ologist to the end, like cardiologist, dermatologist, and so on and so forth. Again, you need to memorize those, please, and let's give you more examples on these terminologies. Myocarditis, inflammation of the muscle layer of the heart or the heart muscle. Hypoglycemia is abnormally low glucose level. Hyper is the opposite. Cardiomyopathy, disease of the heart muscle, and so on and so forth. You can read those examples, guys, by yourself. And let's very quickly just review the second part of the medical terms, acronyms and eponyms. So those were the medical terms and how to analyze a medical term. Now we're going to talk about the acronyms. What are acronyms? Acronyms are abbreviation, kind of, initials formed from the initial letter of other words, like ADD, attention deficit disorder, ADHD, excuse me, attention deficit hyperactivity disorder, and so on and so forth. I don't think that there is anything new here that you can add to the sheet that I sent you. But whatever, if at any time, like if there is anything new here, please add it to the sheet. I guess it's all included, just in case. How am I going to I really need to drink some water because. How am I going to do the translation or the interpretation of the acronyms? If the doctor, for example, says, your son has ADHD, your son has ADHD, how am I going to do interpretation of this sentence to the patient? So I'm going to say in the other language, your son has ADHD. So you're going to use the same acronym in English as it is, and then you are going to say in your language, attention deficit hyperactivity disorder. Why? Why do I have to repeat the acronym as it is? Why don't I actually just go with attention deficit hyperactivity disorder in the target language and that's it? Because those people, those patients, and those LEPs, they live in an English-speaking community, in an English-speaking country, right? So they're going to hear the acronym a lot. They're going to hear it a lot. So they need to know what it means. What is ADHD? This is the name of a disease that my son is having or my son is suffering from, which is, in my language, attention deficit hyperactivity disorder. Okay? Because again, they need to know what it means so that whenever they're going to, like, using the interpreter as well, whenever they're going to talk to the doctor about the disease, whatever that we're talking about, with the doctor, they can use the same naming of that thing. We're going to have an ATG. The patient here, if they're going to talk to the English-speaking person, they are going to say, "Well, yesterday I did EKG." In the other language, of course, they're going to say that I did an EKG, or they're going to say, "Yesterday I had an electrocardiogram." They're going to either use it in their own language or they're going to use the acronym. Either way, they need to know what this acronym means or what is that, so that they can use it whenever they're going to use the interpreter next time. Or they can use, if they're going to use it, that's fine. If they cannot use it, at least they know what is the name of the procedure they had, what is the name of the disease they're having, what is the name of whatever the shot that they had, what are the three diseases that this shot, for example, is like saving them from or immuning them from or against. Okay, so acronyms again. Acronyms should be said the same way in English, used as they are, and then followed by the meaning or the equivalent in your language. If you don't have an equivalent, you can just go with the meaning, like dilation and curettage. Dilation and curettage. This is a name of a procedure that they do to a pregnant woman who lost her baby inside her belly. So they need to do dilation and curettage. If you don't have an equivalent for this in your language, you can just very briefly describe what is dilation and curettage. We're going to use a device to dilate, and curettage, we are going to clean what's inside or the remainings of the baby inside the belly. Very briefly, guys. There is no need to give like a full description of what is that. Okay, that's in case you don't have an equivalent for that in your language. Someone said that they're having a question. Diego, what's your question, my dear?
Yes, Norhan, I wanted to know, well, could you please go back to the previous slide?